Now, the Minister of Health, Dr. Osagie Ehanire, joins us on the program. He joins us via Skype. We'd like to thank you, Honourable Minister, for joining us on the program. I want to begin with the plight of the resident doctors, one of the backbones of healthcare systems, you'd agree, in the country, and not forgetting the Joint Health Workers Union, who are preparing to go on strike next week. And this is coming particularly at a time that we are fighting a pandemic. I'd like to begin by asking, you must be closely monitoring the meeting with the resident doctors. Can you tell us if they've reached an agreement and where they are?
Well, it's not a good idea to go on strike at this time. I've sent a letter and and also issued a communique to the National Association of Resident Doctors that this is not a good time. If they think that the country is at the moment in a position of weakness and they can use this opportunity to pull for demands that really have nothing to do with the present situation we're in. Some of them are from way back. It is not very helpful. The COVID-19 related benefits that were approved were actually made with very good intentions. To bring some measure of recognition and appreciation to the work they are doing. But it's turning out to be something like a thorn in the flesh. It shouldn't be that way. We are urging them to go back to work and also resume continued negotiation to reach a solution that will allay all fears.
The demands of the doctors are not new. If we take a look at some of the demands, asking for life and death in service benefits for all health workers, you are aware that we've lost a number of frontline workers to the COVID-19. I mean, is this too much to ask for?
No, it's not too much to ask for at all. I'm a doctor myself and I know the meaning. But you see, there are many things here which are not in the hand of the Ministry of Health or directly in the hand of the patient. The insurance subject is under the office of the head of service, civil servant activity. And we are urging the office in charge to expedite settlement for those who lost their lives and to ensure that the insurance is well kept. We are fully in support of that. But these are not things that will happen overnight, and they are not things that are going to be swept away. It will never be lost. I mean, if you don't get it today, you get it tomorrow. Yeah, that's sure, because a contract is a contract. And if you don't fulfill it one day, there's no need to fear that that's the end of it. So it's just going to be delayed. We are going to ensure that all those promises are kept.
Indeed, that is what NARD is saying. This delay is becoming too long. There are outstanding salaries for work that has been done. One of the other demands is the payment of the hazard allowance of the workers and the payment of the COVID-19 inducement allowance. And this is as agreed by the Ministry of Health.
Yes, first of all, salaries are not outstanding. Salaries are paid up to date. The hazard allowance was outstanding up till, I think, a few days ago, as agreed, but there is another tranche that's coming up on stream, which we are talking about with the Ministry of Finance. What they must understand is that there are several ministries that deal with these issues, and not just the Ministry of Health. There's other ministries who are participants and stakeholders in seeing that these activities are carried out. And these ministries have a lot of on their plates, I would say. So what we do is to advocate and urge for attention to the doctors, and on the other hand, ask our doctors to show a little bit of patience and understand the pressure under which the government is at the moment, and to be assured that they will not be shortchanged. That is one of the assurances we can give them.
Do you see an end to resolving the dispute?
I see an end to it. I have urged them, the young doctors, to come to my office if they have a problem. I have my door open. I received notice of this strike, I think, either on the day or it started or the day before. But I think what they should have done is to engage me, come to me, and they will see. And in their presence, I will in their presence, put in the efforts that we have been putting in by engaging the ministries that are involved, so that they see that the ministry is actually doing its very best. And you can only go so fast. And again, the rest of it is assurance that, yes, we're on your side. We are same professionals. We know what you face. We have faced those circumstances before, and we are not leaving you behind. So if you can't get things done now, be patient a little bit. The government is under a lot of strain at the moment because of all the multiple challenges that we're attending to.
Still on the issue, resident doctors, we would like to know if you can give us some assurances. What would they be as to when indeed the doctors will get their monies, as to when they will be paid so that they can call off the strike?
Well, they are negotiating right now. As I told you, we don't have a result yet. At the end of the negotiation, there will be a communique and the agreement, or an MOU, and the agreement will be announced. We are propagating the idea that they should return to work while that negotiation goes on, so that they don't allow people to suffer. They don't run the risk of having people lose their lives in the course of trying to fight for their rights or fight for the payment. That can always be done. We're on their side. We are advocating on various fronts. So at the time they will get the money, I do not know exactly. I spoke with the Minister of Finance today, and she has assured us that she will be ready to cooperate with us as soon as all these issues are aligned. But up till the first 3 months have been paid of the hazard allowance up to June. The rest of it is subject to negotiation, which will be done today.
NARD should be patient, but if they refuse to, you've also said that negotiations are on at the moment. We understand that there is a directive, but that the National Youth Service Corps members, resident doctors, should take over from the striking resident doctors. How true is this?
Well, not take over. They are to support the consultants. Consultants are a category of senior doctors who run the programs. They are supported by youth doctors, who are junior doctors. Normally, the consultants oversee the work of the residents, and the residents oversee the work of the youth service doctors. But right now, the consultants will oversee the work of the youth service doctors to make sure that, number one, the COVID centers are attended to. Number two, emergency centers and essential services are attended to. And then routine services are, as much as possible, also attended to. And in very, very difficult situations, they may have to bring in locum doctors. Those are doctors who are hired to stop gap so that services are not totally disrupted. The ministry has a responsibility to ensure that Nigerians continue to receive health service.
Let's look at the coronavirus pandemic fight. We understand that the Russian ambassador delivered a memoir for the vaccine. Tell us about the efficacies of that. We also understand that you refuted that Nigeria had received samples of the vaccine.
The vaccines are not yet out for distribution. They are still being tested. And there's no country that's actually applying them yet. The Nigeria, we have the responsibility here as Ministry of Health to ensure that Nigerians are able to have access to those vaccines when they eventually become available. So the Russian ambassador came to give us just an idea of what they are doing. They submitted and did a memoir that told us how far they had gone with testing their vaccines. The tests they have done, they are already in phase 3 tests. And we also had them have a conversation with our experts here, advisors, Professor Tomori, and the director of the Institute of Nigerian Medical Research, and also the chair of the Nigerian Bio-Vaccine Limited, who also asked questions as to the possibility of licensing for production here, or collaboration, technical collaboration with the Russians. We have also, of course, been in conversation with American authorities and also with World Health Organization. So we're looking at all areas, all channels to secure availability of vaccines for our citizens when they come out. Of course, they all have undergone the necessary tests and validations before we go into that. So we're just casting our net wide to be sure that we do not lose out when these vaccines become available. We were told that the Russians already have 20 countries that have registered for theirs or have expressed interest, including Saudi Arabia, United Arab Emirates, India, Mexico, and several other countries. So we are on the list there, expressing interest and hoping that we can have further conversations with them, with our technical team and theirs.
And finally, before we let you go, Dr. Hanire, we understand that in 4 months, the Presidential Task Force spent 22 billion naira for the COVID-19 fight. Can you tell us briefly how exactly the money was spent?
Well, I cannot tell you exactly how the money was spent. The Office of the National Coordinator is the one handling those details, the details of expenditure and procurements, or rather the allocations. So exactly how it was spent will have to be the subject of a financial report, which I'm sure you will get.
And when will that be? Because a lot of people want to have an idea of the breakdown.
Well, I do believe that there will possibly be an interim report, but definitely a full report at the end of the life of the PTF. The interest of the public is quite understood and also welcome, and the interim report will be issued if the accounting has been concluded. But there's effort all the effort is being made to spend the money as judiciously as possible and to look at all the areas or gaps and make sure they are covered and that nothing is missing. Right now, we are happy that we have a good stock of materials. We are not complaining anymore about test kits or about PPEs, and the infection rate has gone down. We have laboratories in almost every state now. So we're able to feel more confident about our response to COVID-19 than we have ever felt at any time before.
Minister of Health, Dr. Sage Hanire, thank you so much for joining us on the program. We look forward to a truce with the government and NARD, and of course, as the ministry and the PTF fights the pandemic, we hope that indeed it can come to an end. Thank you so much for joining us on the program.
Thank you very much for inviting me, and I use this opportunity to also ask the resident doctors to lay down arms and resume work as soon as possible, if possible tomorrow.
I'm sure they're listening. Thank you again.